I'm Glenn McGinnis, and this is Outburst. On the program, should we continue with public health measures or just learn to live with COVID-19?
Learn to live with it.
Well, I think kind of both.
We've been going through this for like 2 years now.
But I think we need to be a little bit patient.
As we approach the 2-year mark of this pandemic, we've seen lockdowns, gathering restrictions that have prevented us from seeing family and friends, businesses folding, and people stressed out to the max. But now, here in Canada, we're starting to see provincial jurisdictions loosen the rules for their citizens. And we're also seeing countries like the UK and Sweden loosening their rules as well. So, should we continue to exercise caution, or should we put this pandemic behind us once and for all? Our question. Should we continue public health measures or just learn to live with COVID-19?
That's a great question. I'm 100% on the boat of, for me, the pandemic is over. I think what we saw with the vaccine that, it doesn't necessarily stop transmissibility. You can still get it even if you have the vaccine. I got it personally after I had the vaccine. And I think that we did our best. I think 2 years is enough time to open up society, let people live. You see other countries dropping their mandates, and I think that in order to rebuild trust with your population and have people go out there, spring's on the way, people want to see smiling faces and thrive off of each other's energy, and I think that it's really important to go ahead and open things up, let small businesses thrive, and let's move forward with it all. Let's put the pandemic behind us. We did what we could, and let's keep working on that, obviously. But I think it's time, when you look at the residual cost of people, mental health, and jobs that were lost or businesses that failed, I think that residual cost is so huge.
I'm done. I am so ready for this to be over, but I do not think that we should end it prematurely if it means that we are going to be hurting, potentially, people that are less advantaged or with illnesses, things like that. So as much as I want to say yes, end it, let's go, if it's not safe, I don't think it's the right thing to do.
Learn to live with it.
Learn to live with it.
Yeah. At the end of the day, we've been going through this for like 2 years now, and at this point, obviously, COVID is real. Nobody's disregarding that, but I think it's about time that we, actually start putting our lives forward and doing something versus just being shelled off and locked down.
I think we should be educated as to what we should and shouldn't do and expect that maybe we have to make some changes, but I think we have to be aware and be kind to each other in terms of the regulations.
Well, my suspicion is that some prudence is required, such as encouraging people to wear masks, but realistically there's a limit to what can be done. And to start, we've seen the reaction in Ottawa to the measures. I don't think that, I don't have much sympathy for people inconveniencing our population of the whole city. But at the same time, I think measures need to be scaled back so that we can get back to some sort of normality, as long as it's safe, and it does seem to be so at the moment.
Well, I think kind of both, because it's been many years of restrictions, and of course we can't be doing this the whole time, but we have to make decisions based on science, so I think slow and steady is kind of the way things should go.
I think we should continue following public health measures. I know it's difficult, and like I said, it has taken a toll on our mental health for sure. But I think we need to be a little bit patient. I can see the light at the end of the tunnel, and we can just be more patient and kind to each other. That would probably be more helpful.
Honestly, this is an unpopular opinion, but at this point, everybody knows the risk. Everybody knows how at risk they are, or how affected they would get depending on who you are. You know what I mean? At this point, I think maybe loosen things up a bit, because you're an adult. You can make decisions for yourself.
I would like to know where the light at the end of the tunnel is.
Yeah. And at this point, I think the negative effects of being in all these different mandates, workplaces not being able to function properly, we're not able to see our families and friends and get back to norm. I actually think those effects are probably now outweighing the effects of COVID. Mm-hmm. And there's only so much we can do. We've done the vaccines, we've done the masks, we've done the closures. Like, how much more can we be doing? Because if it's not working, we just need to kind of, I don't know, sounds harsh, but get over it and move on.
That's a tough question. I mean, you look at the businesses around here and stuff, and I don't want to see any of them go out of business, right? But it's a balance. So the public health measures we have are decent, like vaccine passports. I mean, they're annoying. You don't want to have them, but making sure that if you do get it, it's the least impact on our healthcare system. That's what's important, right? So some mandates like masks, this is not a problem. Sure, my glasses are fogging up right now. You know, that's what you got to deal with to help protect other people. So I'm okay with that. Lockdowns, I mean, right now we're doing with Omicron, and they keep getting worse. So the more that we get a variant that gets worse, the worse this could get.
If their vaccines work the way they are, the people that need to be protected against it are protected. And everybody else probably has been exposed to COVID and has natural immunity already. So it's time to start living life, get life back into the businesses that have been suffering for 2 years.
Learn to live with it. I understand at first we needed to take certain precautions. Now that the vaccines are out, I mean, a lot of people don't know the vaccines don't help to get COVID-19, to prevent getting it. It's to prevent hospitalization. That was the biggest thing at first, is that if it overwhelms our healthcare system, which we have a fantastic healthcare system, it's not overwhelmed by much. So that was necessary. At this point, we're a little over 2 years in it, I believe, and it just needs to be done. If somebody wants to wear a mask, go for it. If you want to get vaccinated, then great. I'm double vaccinated for the purpose I needed to, because I'm actually a truck driver, so I needed to get it done, but I don't like being forced to do it.
A little bit of both. I think everybody has to decide for themselves what they're comfortable with and go from there.
I think we should just follow the scientists, trust them. They've had our back for our whole lives. I don't think there's anything wrong with following the science.
The bottom line is they need to somehow learn to live with this virus. They need to release people back out to live. I'll hit on mental illness. We're going through, they want to talk about vaccines and they want to talk about lockdowns. They want to talk about this, but no one's hitting on what they're doing to our children. I got 3 children home. They've been locked down. They've been made to come home from school. It just goes on and on and on. Well, how about that sickness? Because when this is all over with, we think we had sickness and death from COVID. You wait and see what happens to the mental aspect. It's going to be bad. You know it.
When financial assistance was made available to Canadians throughout the pandemic through programs like CERB, for those who lost their livelihoods, it was a godsend. But some think it may have a negative effect on Canada's workforce. Some employers have been having a tough time getting people back to work because the relief money provided more income for people than when they were going to work. So we took to the streets to ask Canadians what influence this has on people and businesses. Our question: what impact has federal pandemic relief had on Canada's workforce?
Yeah, I think it's tough because you're talking about, the people that we think are taking advantage of it are also the people that historically have been more marginalized. So yes, in some ways, if you've got part-time workers, for example, or students, or people who've just immigrated here and they're the ones making minimum wage pre-COVID, their income was under $2,000 a month, or per paycheck, if you kind of consider it. So living under $2,000 a month is pretty tough in Vancouver. So I don't honestly fault them for wanting to take advantage of CERB when they had the chance to. But at the same time, there should be a bit limitations on it, because then getting the workforce back, getting all of our different industries back was very hard. I worked in retail and we had just shortage of staffs. Banks have to close because they don't have enough tellers, and all these different industries are a bit more affected by it.
Yeah, it's basically, I think that talks a lot more about what we pay essential workers, because the fact is, when you can stay at home and make $2,000 every 2 weeks versus go to a job, work your heart out, and then come home with less money than that, that's ridiculous. I think it made a lot of people realize that they are worth a lot more.
Well, I think, that's a huge issue as well. I think that you might go right around to a living wage. I think people are realizing that they're what they're doing for very little money is just not worth it, you know, and wage subsidies are not. You know, I think people are just reevaluating what life is all about. And, you know, do you want to slave for minimum wage and not be able to afford anything, or do you want to about face and try and find something that does make sense, you know? So yeah, it's big issues, man. Big issues.
I guess it took a lot of people, it made a lot of people not want to go to work, but that also says maybe the wages aren't high enough. Could be another thing if they're getting more money from the government for staying home, if their minimum wage job isn't paying enough.
Yes, I mean, it does. There were complaints that, you know, people were preferring to take the money and just not do anything for a time. But I think that might have been true for a time. Though it's interesting that at the university, in terms of university courses, it was striking that there was actually a real upsurge in interest, for instance, over the spring and summer of, let's see, 2021, you know, with the pandemic. I think it was a proportionate response. I mean, something had to be done. People were rightly worried, and, you know, in order to keep the economy going, it was, as long, I mean, they were making sure there wasn't too much fraud and so forth. The British government, in contrast, has sort of really lost, it's thrown away, written off billions of pounds, not so much in payments, well, partly in payments which were just bogus for companies and so forth. I don't think Canada's done as badly.
I wanted, and again, working in retail in the mall, I personally, for me, I thought it would be worse. I thought that I would see my staff being like, no, I'm not going to come back to work. But at the end of the day, I think a lot of the people that did have access to it, that benefited from it, were also really ready to get back to normal life. So yes, they took advantage of it. I did myself. But at the end of the day, we were ready to come back, go back to work, go back to normal life. So we didn't need to be accessing it as much. So for me personally, I didn't see it be too much of an impact.
Just look right here in Ottawa, like how many small businesses that do you guys know personally that I've shut down? I know tons of them, right? There's tons of so many one-off shops that I've loved to go, and the Byward Market, things like, you know, the Fish Market, Tucker's Marketplace, that are no longer there, right? And that's just right here in Ottawa. Now you're gonna take that, times it by like all over Canada, and everybody knows somebody that's, you know, lost their job due to the pandemic, right?
People were fired for no good reason, including some of my family. And it's hard. It's really hard.
I mean, there's nurses talking out right now saying, you know, I work at the hospital, but they're so short-staffed that they're letting nurses that are positive for COVID-19 work anyway, you know, because they don't have the staff to look after people. And I think it's just tragic, really.
No one wants to work because of the CERB or because of that myth that the CERB was going to be there to help us. You know, I don't... I think that the topic of universal income comes up a lot with this talk, and I don't know if the time is right for it.
I don't know. We live in a province where the minimum wage is $11.75. I think we should all be getting more money from our government. It's our money.
It's made it really hard to find workers. People have just gotten used to having money handed to them and staying home instead of going to work now, and that would be my biggest problem with it, yeah.
In 1930, Corinne Wilson became the first woman in Canada to serve as what? Senator, provincial premier, or member of parliament? The answer is senator. On February 15, 1930, at the age of 45, Corinne Wilson was appointed by Prime Minister Mackenzie King as Canada's first woman senator. The news took Wilson by surprise. While her appointment was applauded by some, others were not so enthused. But Wilson would go on to become a champion for healthcare, labor, and education issues, and often clashed with the Prime Minister. She was instrumental in creating Canada's first universal welfare program, fought for easing divorce laws, and became Canada's first female delegate to the United Nations General Assembly. Wilson passionately spoke out against the alienation of Japanese Canadians during World War II. And she worked tirelessly to open Canada's doors to thousands of homeless Europeans displaced by the Second World War. Corrine Wilson would serve more than 3 decades in the Senate until her death in 1962. It's no secret that during virtually the entire pandemic, hospitals across the country were reaching their limits. Resources were maxed and ICU beds were filled. On many levels, COVID-19 has been a learning experience for us all. But when it comes to how hospitals and long-term care facilities have fared throughout this, what lessons can we take with us? Our question. What has COVID-19 taught us about Canada's healthcare system?
Well, we were just talking about that. I think that we're very lucky in that we have a lot of access to information and we're able to get the vaccinations when we need them to be given to us and we don't have to pay for them. I think for the most part, I think we're very fortunate. I think they've done a really good job.
That it is vulnerable, that the number of beds, the urgent care beds per head of population is lamentably low. Canada comes towards the bottom of the list. It's the same in the United Kingdom as well. Other countries such as Germany are much better provided for. They've got, the problem is the sort of approach that if you don't need something right away, then you get rid of it just in time. It's all very well for products on the shelves, but it's not good enough for emergency care, which at any moment can be necessary. And so if there's unused wards with beds nonetheless that can be used, then so much the better. And then there's the personnel, and that's the other problem, particularly in Quebec, but even here in Ontario. It's making sure we've got the staff, that the staff are decently paid, and that, you know, they're given the support that they need.
It's a tough situation. You know, we've had cases where things have been delayed, and you know, family doctors being off sick, or you know, staff off sick. It's been a difficult time, and obviously having investment into the healthcare, because they're really people that really worked out very long and hard hours for us, and having limits like the 1% that the Ford government does, you know, we both don't. We're not
agree.
for that, you know.
No, and we know firsthand the effects of it, because he was waiting for a surgery for cancer, and it was postponed. He was lucky enough he had it, but postponing it was a lot of stress on us.
That we are desperately underfunding our healthcare systems, and that a lot of the restrictions that we've had lately would not be there if we had more better funded healthcare systems that could handle taking care of more Canadians.
Our healthcare system's been broken for years now, and instead of putting any actual funding into healthcare, they just spent it all on COVID benefits and COVID vaccines and an overstock of them. So I think the money could have been more well spent on actual healthcare.
I think we've got a fantastic healthcare system, and it's had our back our whole lives. I mean, it's been here for us this last couple of years, and I think it's going to continue to be there for us. It's a good system.
It's been a problem for years and years and years and years. They're not putting money back into infrastructure. They're not putting money back into nurses, the heroes. They're not putting money back into doctors. Where are they putting it? They're not putting it into hospitals.
I think it was shaky to start with. I mean, wait times for surgeries and even getting blood work done, you go up there and you wait 3 hours, right? I think that we need to invest more in that than anything else. I mean, I think that if the hospitals were able to take more people quicker, then we could ease the restrictions. So to me, this isn't about like the public or whatever. This is about funding of healthcare. If I felt good that, you know, if I did get sick, I could go to the hospital and be taken care of quickly, I'm okay with that. Even with my mom, knowing that she could go in and get treatment and not be like forced to sit in a hallway or possibly not even get in, right? That's what I'm concerned of. So I think if we put more money into healthcare, we could open up quicker.
That they need to start focusing more money on that, focus their efforts on that instead of policing people trying to live a normal life. Maybe they should spend the time in Parliament figuring out what's wrong with our healthcare system and why our healthcare system can't support a virus that, for the most part, has the same symptoms as a cold or a flu, why that brings the healthcare system to its knees, and we have to live this way. So they should start focusing on that instead of fining truckers for coming to peacefully protest, that sort of thing.
Definitely it needs work. I mean, we all know that. I don't think there's anybody here that's going to say it's great. I mean, you can compare us to the States, but it's apple to oranges, right? Our free healthcare system compared to a paid healthcare system. I believe in free healthcare. I think it definitely should be a priority to maximize. I think people's safety is #1 priority, and the healthcare, I think, definitely should be improved. And I think the COVID-19 definitely illustrated that we need a lot of work.
It's never been adequate, especially in New Brunswick. New Brunswick healthcare is really poor.
Well, as compared to the U.S., it's terrific. And I mean, our death toll is about 1/3 of what the U.S. have experienced. So you have to say our healthcare is very, very good.
Maybe one thing to criticize is that it didn't reach everyone with the vaccinations. If more people would have been vaccinated sooner, this would have been over already. So I think for everyone it's getting a bit tiresome that this situation is dragging on, and it wouldn't have been necessary if more people would have been vaccinated earlier.
We've found all kinds of holes in it. Like one of the things was Canada was not prepared for this at all. One of the things that has of course came out only a few months later was that they actually destroyed a whole bunch of masks and stuff just a few months before, and we didn't. And there was a committee or a group that was supposed to look after this, and I think they were disbanded like in 2018 or like a year before. So Canada was not ready.
And I work in healthcare, senior care, and I think our health care systems stepped up. They were awesome.
Finally, as we discussed restrictions being lifted earlier and the lessons we can take from COVID-19. For the past 2 years, Canadians have had to find a way to get them through this pandemic and avoid the weariness that may go along with it. We took to the streets to ask Canadians how they got themselves through this pandemic to avoid the exhaustion. Our question:
what are your ideas to avoid pandemic fatigue?
I don't know. It's good to disconnect, take a breather, get some fresh air, take time for yourself, and start again.
Be more social, go out, spend time with the people, and go outing and stuff like that. And I think that's only the way you can recover from it.
Stay busy, eat lots, get outside, social distance, gatherings, Yeah, that's about it.
Like dealing with fatigue, that's the big one, right? Like you gotta find the things that energize your batteries, and at the same time keep your family, friends, and community safe. It's a tough one.
Oh, I think everyone is suffering from it. I think you just have to get out and walk your dog or walk yourself, especially in the rare nice days.
But just the idea that it'll get better, and then I think it's just try our best during these times, because personally I'm fortunate to still have shelter and have food and have friends to talk with, and there are lots of other unfortunate people still, so just try to keep myself positive for the time being.
Well, I work as a therapist, so I know that in the past 2 years COVID has taken a big toll on people's mental health. So I think different things that we can do is going for walks, just getting some fresh air, moving our bodies, doing therapy if you can, talking to someone, and just keeping in touch. I know we can't see people face to face sometimes because of the restrictions, but just using different channels and different media to get in touch would be helpful.
I think for our age demographic as well, specifically, we've kind of been robbed of our 20s and the things that you do that make it, make that time enjoyable. And the only things we do have are walks and going to restaurants and working out. So at least opening up the gyms again has been really nice, and being able to get our physical health back in shape and not just focus on working and trying to battle COVID, and trying to spend some time with family. I know there's obviously regulations on the number of people you can have, but sticking to your bubble and just making sure you're being a bit proactive with it and making time to see each other, even if it's for a 15-20 minute walk, seeing each other in person. I think the the digital aspect of COVID is getting really fatiguing, I guess. I don't know.
I think what's important is self-help. So I guess enjoying yourself, enjoying your time. Time flies by really quick, so I think it's important to read books, hang out with your friends, study more. Use your time wisely. I think that's very important, or you'll regret it when the pandemic is over. You'll think, I could have learned new languages. There's a lot more you could have done.
I think making a phone call to different people each week, staying in contact with people, going outside, even going for a walk, looking for something good to do for somebody else, and maybe taking time in your own life to do something nice for yourself each day. That's kind of what I live by.
I think it's very important to remain active and get outside. Don't stay cooped up in the house. Go for a run. Do anything that keeps your mind off of every second and every minute. And do something for yourself. I find that when you work out or when you take care of your body, that it relieves a lot of your anxiety. And on the bright side, it seems like we're getting to an end. So, yeah.
I think a lot of it is going to be about family, getting outside. I think being outside, trying to enjoy the little things that we have access to, the canal, even right now when the weather is so awful, being able to go out, even if it's about going to a museum or something small like that. I just went for lunch by myself, so I think that's a big part of it too.
Actually, we've been very good. We've stayed home and kept busy doing some project at home. And first of all, we've been vaccinated, for sure.
Doing family things, like keeping the bubble closed, doing every second week, doing
family
reunions on
online
and so forth, and then trying to get people in the house, but gradually, going into that.
I started exercising a little bit more and doing I tried to pick up hobbies. I also tried to learn a language. I'm actually going to Italy now because I started learning Italian. And I was I want to further that. So now that we're allowed to travel again, I'm going in March to Italy. So just picking up new things.
I've continued as normal largely. I teach at the university, so I've been teaching online. But we found ways around the problem, and now we're doing it bimodally. So some people in the classroom and others remotely, and that seems to work very well. But personally, yes, you just sort of make do with online things, but we're coming, it looks like, to the end, so much the better.
Thanks for watching this episode of Outburst on CPAC. If you have any comments about this show or any other show, you can find us on social media. You can also find us on our website at www.cpac.ca. I'm Glenn McGuinness, and on behalf of my colleagues at the Cable Public Affairs Channel, thanks for watching. We'll see you next time.